want to see if there's any change at all.
Okay.
And this might be really early, so we'll just, it's okay. Just smell it first. See if you can smell it. Is it, normally would you be able to smell it?
Oh.
All right, where are we going?
Is it strong? Yeah. That's so exciting.
You feel like you're in this box. Before 2 years, it's 2 senses are completely gone. And now I just feel like I'm getting my life back. I'm getting back to normal. It's thankful.
This is an amazing story that this woman was finally able to get some relief of her long COVID symptoms after over 2 years of struggling with this by getting a procedure called a stellate ganglion block, which I'm going to teach you more about in this video, which is an emerging treatment not only for long COVID, but for other conditions as well. These stellate ganglion are a collection of sympathetic nerve fibers that are found just above your first ribs on both sides of your neck, so you have 2 stellate ganglion in your body. Using an ultrasound machine, a needle is placed into that space where the stellate ganglion is, and local anesthetic is injected there to help block sympathetic activity coming from those stellate ganglion nerves. In case you're not aware, the sympathetic nervous system is one arm of the autonomic nervous system that's involved in involuntary processes that your body undergoes, such as breathing, digestion, heart rate, blood pressure, and sexual arousal. You can think of the sympathetic nervous system as your reflexes that are involved in fight or flight responses, versus the parasympathetic nervous system is the responses related to rest and digest. A stellate ganglion block is usually done on one side of the neck at a time, and then the other side's done another day. And so when you have a successful block, you have something called Horner syndrome, where that pupil is constricted, it gets smaller, the top eyelid droops in what we call ptosis, and then there can be some redness around the eye that occurs as well. This review article goes over how these nerve blocks can be potential treatments not only for long COVID, but for other conditions as well. Other conditions besides long COVID may include PTSD, anosmia, chronic fatigue, hot flashes associated with menopause, and ventricular tachyarrhythmias as well. From the standpoint of treating long COVID, stellate ganglion nerve blocks may be helpful in treating chronic fatigue related to long COVID, because when you block that nerve, it decreases that sympathetic nervous system response, which can decrease some of those chronic, stressful, inflammatory responses, leading to improvements in long COVID-related fatigue. Now, patients who are experiencing anosmia or other smell disorders related to COVID-19 infection may have improvements after a stellate ganglion nerve block, because it could improve blood flow to the olfactory nerve, which is involved in sensing smell, as you decrease that sympathetic nervous system tone. Right now, most of this work is being reported as case reports, and so there's emerging evidence that this could be a potential treatment for various conditions, including long COVID. Some of these people may have benefits that are longer lasting. Others may need multiple rounds of nerve blocks to get this type of benefit, but it's nice to see some positive results for people who have been struggling with all sorts of disorders. If you have any further questions, feel free to let me know in the comments section, and have a nice day.